So my name is Dr. Skip Cummings. I'm a professor of family medicine at East Carolina University and a pharmacist by training, and I'm pleased to continue our training video today and chat with you some about the role that medication management, and in particular the role of pharmacists, can play with COMPASS patients. So next slide. So just want to encourage you, as you're involved with the COMPASS project, that pharmacists can be a really incredibly important part of the team. That COMPASS really is about interprofessional care for some of these complex patients who've suffered a stroke. And our local pharmacists throughout the state can provide a tremendous resource to come alongside the rest of the care team and deliver some needed care to help make sure that medications get properly used in a safe and efficient way for our patients. So several things to keep in mind. The first and most important point as we think about our work with these patients in the COMPASS project is identifying patients who are at risk. So one of the key takeaway points is that we would really like the entire care team, in particular the post-acute care coordinators, the advanced practice providers, primary care providers, to be able to identify a priori those patients who've suffered a stroke who may be at increased risk for medication-related problems. And so you see listed on this slide several of the potential categories of patients who we believe may be at particularly increased risk for problems. So those include patients who, for whatever reason, cannot get access to medications that specifically would be helpful in terms of secondary prevention of stroke, blood pressure meds, lipids, anticoagulants, aspirin, etc. Another group would be those who have challenges with medication non-adherence, folks who are on high-risk medications like anticoagulants and who are at risk for bleeding, folks who are taking multiple medicines or polypharmacy. And since that's going to be the case for many of these patients in the COMPASS project, we would add that it's the subset of those folks who clearly don't have the support at home from a caregiver or someone else to help them with their medications, or those who have suffered some degree of cognitive impairment and may have real challenges with respect to health literacy and or health numeracy. That's a particularly important skill in terms of medication management. And the last group is identifying those in whom you might need some help to help monitor these patients in an ongoing way in terms of monitoring their consumption of their medications on a regular basis, blood pressure monitoring, monitoring of anticoagulants, in particular warfarin with INR, as well as diabetes medicines. So again, the big picture here is we want you to identify these patients ahead of time, and for those that are at risk, we're asking you to consider engaging local pharmacists to come alongside you and to help these patients manage their medications and limit the likelihood of medication-related problems. And so we are particularly fortunate here in North Carolina that because of the leadership of CCNC, we have a fantastic network of pharmacies, almost 250 pharmacies across the state. These are community pharmacies, mostly independent pharmacies, and they have already agreed to come alongside challenging patients with chronic disease and to provide what they've called enhanced services, spending extra time with your patients to make sure that they understand their medications and can take them effectively. And so what we've done in COMPASS is to create a referral form that you can utilize. This referral form will reside on the COMPASS website. You can pull that down, and for any of those patients who you've identified that are on the previous slide, in other words, higher risk patients, we encourage you to complete one of these referral forms identify the reason for the referral, or simply write in the other line that you really need help with this patient who's on Coumadin and multiple other medications. You want the help of a local pharmacist to help monitor that patient. Have your staff complete the rest of the information. And then, as I'll show you on the next slide, look for a pharmacy that's in your area, close to your hospital and close to the patient that's being discharged. And then to fax this form to that pharmacy, and then ask them to follow up with your patient to try and provide these additional level of services for your patient. So you see on this slide this network that I alluded to. And again, this is thanks to the leadership at CCNC. They've worked really hard to recruit a number of independent pharmacies all across the state. And on this slide, you can see not only the pharmacies on the map, but you see a network link there. So you can copy that link into your browser and go to the CCNC website, which will provide much more information about this entire network. You also can click on any one of these little balloons and get more information about that individual pharmacy and how to contact them, names of individuals and fax numbers, etc. So again, I want to encourage you that this is a critically important resource that could be useful for our COMPASS patients, particularly the subset who is at significantly increased risk for medication-related problems. I want to highlight that because this is a CCNC-developed network, that the eligibility is limited, as you see here, to those patients who are either on Medicaid or Medicare, and that includes Medicare Advantage programs, patients who are dual eligible, or patients that may be North Carolina Health Choice. But I would add that this is a substantial number of our COMPASS patients would fall into this eligibility category. For the pharmacists that are watching this video, I want to encourage you that providing these extra services as part of this network is reimbursable as a result of funding that has come from CMS to CCNC, and that this reimbursement to your pharmacy will be available from now through at least summer 2017, and we're hopeful that this will be extended and or renewed for an additional period of time. So this falls right in with the beginning of our COMPASS project, and we're excited and appreciative of CCNC's leadership. So on this slide, again, a way to get more information about this network. Up on the right-hand side of the slide, you can see that there's some information available that we intend to provide to primary care providers in the region who are engaged with COMPASS patients. We'll try to make that available as part of our regular communication to you. Again, I've given you the network link at the bottom of this slide. More information about this entire network and the process for accessing it and using it is available at this link. And also, as you see in the middle of this slide, many of you are familiar with the CCNC network, and there's a map showing all the regions. I've given you a table that shows you the directors of pharmacy for each of the individual CCNC local networks. And so we'll be providing additional information about the COMPASS project and this intervention to each of these directors. And you can feel free to use them as an additional local resource about accessing this network system. So for the pharmacists in particular, I want to spend a few minutes talking to you again about how this system will be used to engage you and how we would like you to work with these patients. So again, in the big picture, the idea is that high-risk patients will be referred to pharmacies who are part of this network in order to provide what we would describe as enhanced pharmacy services, and that's consistent with the CCNC definitions that are part of this grant. And so we are asking pharmacists who are close to and receive a referral from a local provider regarding a COMPASS patient to contact that patient And to help deliver these services, in particular, we'd like you to make sure that the patient has access to the medications that they need in order to prevent a second stroke. And so that will involve performing medication reconciliation. That can be done in the local pharmacy or via a visit to the patient's home. So we're asking you to look at the discharge medications, which can be done either via a copy of the prescription, or each patient should have a copy of their own e-care plan that you can review with the patient there in the pharmacy or in the home. Certainly for those patients who may have some cognitive dysfunction or where you have a heightened level of concern, we'd encourage you to identify a caregiver that can work with that patient, another family member, the spouse, a child, etc., who can come alongside that patient and help with these medication challenges. So the other tasks that we're asking you specifically as pharmacists to be involved with is if the patient needs medication, to provide those medications based on the prescription from the advanced practitioners or from the local primary care providers. We also would like you to be involved with that patient to really help them with respect to medication adherence. We've given you a toolkit. I'll go over that in the next couple of slides. We'd like you to be able to assess where the patient is at in terms of their medication adherence and to deliver that extra measure of counseling or guidance or support to make sure that the patient is likely to take their medications exactly as prescribed. When and if it's necessary, we'd encourage you to at least consider the possibility of making a home visit to that patient. It's really eye-opening in many situations and can help give you as a pharmacist a stronger connection with that patient to really understand if they have the medications that they need and if they understand how to take them properly. And that would include reinforcing medication adherence, checking their blood pressure in the home, and then contacting the APP or primary care provider with any problems that you identify. And then, as I'll allude to in another slide, we'd like you to continue to follow up with that patient on a monthly basis to ensure that the patient continues to have their medications refilled, that they're taking them as prescribed, and to query them for any problems that they're having with their medications and report those back to the primary care provider. We would ask you to keep a record of your contacts with patients. We'd like to make sure that we have a way to track the magnitude of the intervention by pharmacists in this project. We've provided for you an optional medication reconciliation form, so in particular the PACs or post-acute care stroke coordinators. We're asking you to do medication reconciliation in that 2-day call with patients and to follow up with them and make sure that they have the medications filled that were given to them by prescription at the time of discharge from the hospital, and to make sure that they have those medications in the home with them. And if not, to try and resolve that. And same for pharmacists. We'd like you to be involved in this medication reconciliation on patients that you get a referral on. To do that, again, either in the pharmacy or in the patient's home, preferably if that's possible, to make sure that the patient, again, has access to the needed medications. If there are financial or other challenges, we'd ask you to work with that patient to try and get them access to medications that they need, or to work with the provider to change the prescription in the regimen so that the patient can afford and have the medications that they need to take. The next 2 slides talk about a toolkit items that we'd like the pharmacists, again, to use. This will be available on the Compass website. This is a toolkit, a handy little option for you to gauge the patient's level of medication adherence. So you see kind of a blue line there in the middle of the slide. We're asking you to work with the patient and have them mark. Just simply put a mark on the line that indicates their level of medication adherence. So the question is, as you see here, All things considered, how much of the time do you use all of your medications exactly as prescribed? We think that many patients will mark all of the time, indicating that they take their medications on a regular basis as prescribed, but there certainly be an estimated 25 to 50% of people who will mark somewhere else on that line and indicate that they're having adherence challenges. So if the patient marks somewhere else on that line, indicating that they're not taking their medications consistently as prescribed, we'd ask you to ask them the questions in this box that's below. And really what this is trying to get at is to help the providers and the team sort out exactly what are the problems or the reasons that that patient is not taking their medication as prescribed. Does it relate to side effects? Is it the cost of the medication? Are they forgetting, just simply forgetting to take the medicines? So again, asking you to circle the reason that they're having these problems, and then to use the information that you see on this slide to help give a more tailored response. So the idea here is this is not a one-size-fits-all approach to medication non-adherence, but really to try to focus on the specific problem that the patient identifies and look at how you as a pharmacist, for these patients that are referred to you, how can you intervene with them to make sure that they have the medicines and that they're taking them on a regular basis. So this may involve contacting the provider in some situations in order to change the prescription or change the regimen so that the patient can afford it and take it. It certainly will involve spending more time with the patient to make sure they understand the medicines and what they're for and how to use them. And so making those small behavioral, lifestyle, day-to-day changes to ensure that the patient takes the medications exactly as prescribed. And again, we appreciate the way pharmacists have the skill and the ability to do this. Certainly pill boxes, calendars, technologies like phone alarms can also be used to help ensure that the patient takes their medications appropriately. We'd like you to keep track of what interventions you recommend for patients and to keep these records for us to collect and to track as part of the COMPASS project. So again, as I alluded to earlier, in addition to simply focusing on access to medications and medication adherence, we'd also like you to be involved in an ongoing way with these referred COMPASS patients to make sure that they continue to refill their medications, continue to take their medications as prescribed, and to help the rest of the team with respect to adjusting doses or getting the patient to a place that they're doing well in terms of their target goals with their medicines. So again, monthly follow-up by the local pharmacist, by phone or in the pharmacy, again, screening for problems with accessing medications, with medication adherence or side effects, reporting any major problems to the primary care provider or the post-acute care coordinator for the COMPASS project, and directly intervening with these patients. We'd also like you to be proactive and help monitor that patient's blood pressure and to make sure that they're getting, if they're on warfarin, regular testing of their INR to make sure that they're on the right dose of warfarin, and to contact the provider as necessary. So pharmacists, many of you are already familiar with how to do this. This is a reimbursable service for pharmacists to help support care for these chronic disease patients. So for eligible patients, and again, those are Medicaid, Medicare, dual eligibles, and North Carolina Health Choice, in order to get paid for this service, you can simply enter data into the CCNC's medication management platform, which most pharmacists are familiar with. And generally speaking, this documentation consists of medication lists and drug therapy problems and your specific care plan as a pharmacist. So This is the strategy for pharmacists to get paid to help support this important component of care for our Compass patients. So in summary, we'd like to remind you that medications are a critical component of care for our Compass patients, that we are asking you as pharmacists and the rest of the team to focus on these areas, making sure that the patient has the right medications to achieve the correct goals. And those are things related to blood pressure, to lipids, to INRs, etc., that are impacted by the medications that they take. Ensuring that the patient has appropriate access to the right medicines at the right time and continue to get those filled and take them. For patients with polypharmacy, to think about how you can assist them with management of multiple medications. And again, this is particularly important with respect to the caregiver item. So if they don't have a responsible medication manager, it would be helpful if you could work with them to identify someone that could help them with these multiple medications. Again, especially important if there's any degree of cognitive impairment related to the stroke. Certainly supporting adherence, as we've talked about, working with a primary care provider to support adjustment or intensification of medications, especially important with respect to blood pressure, to make sure that the patient's blood pressure remains under good control in order to minimize their risk of another stroke. And again, to be reminded, all of us to be reminded, that the pharmacist is an important part of the Compass project and the primary care provider team. So in closing, we deeply appreciate your attention and the opportunity to share with you important information about the Compass study. We're all excited about this project and believe it will help to transform the way care is delivered for stroke patients who go home following this acute event. We want to encourage you to stay in touch with your local post-acute care stroke coordinator for your area, and to access the Compass website. And you see the link here. This is an important resource where many of the things that we've talked about today will reside, and where you can access that information and forms necessary. And here's just a picture so you get an idea of what this looks like. So again, thank you for being our partners to help make this study a significant part of transforming the way care is delivered for patients following an acute stroke in North Carolina. Best wishes.